3 quick yes or no questions for you. Okay. Number 1, just a simple yes or no. Would you be willing to drop your government-run healthcare insurance where the taxpayer actually pays 70% of your premiums and go and shop for insurance right here in the state of Wyoming like we have to?
Sure.
Just to make an example, I mean, would you do that?
Ryan, I had better health insurance when I was practicing medicine in Casper before I got this job. I think everybody ought to have the same choices that members of Congress have. I have Blue Cross Blue Shield of Wyoming. That's what I have right now.
Okay. They are actually a contributor to your campaign, though, correct?
Oh, I'd have to check the list. I've had them for years.
Okay, before I get into the other quick yes or no questions, I did want to ask this, because I just remembered it. Other than tort reform and being able to buy insurance across state lines, what else do the Republicans have that they would like to put out there in a health care bill to help out people like me?
Well, those are 2 big ones, because those are both going to save you a ton of money, almost maybe half of the amount of money. Because we see in Maine versus New Hampshire, the rate for somebody who's like you in late 20s, healthy, it's two times more expensive in Maine than it is in New Hampshire because of Maine government regulations. So those 2 things would actually save you a lot of money. But then we want to give personal incentives. So if you are somebody that's going to the gym and staying healthy and keeping your blood pressure down and your cholesterol down and going to the Wyoming health fairs and knowing that you're in good shape, that you ought to pay less than somebody who's not taking care of themselves and acting responsibly. We want to give personal incentive opportunities. Plus, let small businesses join together. Though they can't do that now. So maybe your radio station and others could join together with other small businesses and get better deals for buying health insurance so they could supply those.
Well, where do you stand on pre-existing conditions? Because sometimes, a kid, it can be 5, 6 years old and have something happen to him or her that can prevent them for the rest of their lives getting health insurance.
Yeah,
and it wasn't
wrong.
a choice.
My wife, Bobby, is a breast cancer survivor, and she's 6 years cancer-free. She's been through 3 operations.
Congratulations.
2 bouts of chemotherapy, and at a point she still needs to have insurance, as do other people that have had, cancers as teenagers and things like that. So absolutely. What they're seeing in Massachusetts, Ryan, is a little different. Is people are saying, if I don't buy the insurance and just pay the penalty, and then wait till I get sick, then I'll go out that next day and buy insurance. So they're kind of saying, let's game the system. And you don't want people to be gaming the system with other people's money, but you do want to make sure that people, legitimate pre-existing conditions, that those are covered. Because there are 1.5 million people in America, Ryan, that fit that description that you gave earlier. We need to make sure they can get insurance and aren't denied care. Okay,
my last 2 questions really don't have to deal with health care. Number 1, the Tea Party movement is growing. It is becoming huge. Sarah Palin, Jesse Ventura has been coming about this. The 9/12 Project. Tea Party movement is just a force to be reckoned with right now. Would you consider yourself a teabagger?
Well, I consider myself a conservative. I have a voting record. People can look at my voting record and say whether they approve of it or not. I focus on the people of Wyoming.
And finally, I've been wanting to ask this question to somebody in Congress or that's in Washington since I was 5 years old. Can you confirm or deny a government cover-up of aliens or UFOs?
Well, that's a good question, Ryan. I don't know anything about it.
Okay, so you can't confirm nor deny, though.
Well, you've been waiting 23 years to ask the question, Ryan. I think you probably better ask somebody who knows more about it than I do.
Can you get me hooked up with those people? Because I really want to know.
Hey, come back to Washington and we'll try to see if we can have you meet some folks.
Do you see this vote happening this week?
If Nancy Pelosi had the votes, they would vote today. So they don't have the votes yet.
And it's all because of that abortion issue, really.
Well, it's also the cuts to Medicare. It's the sweetheart deals. It's the increase in taxes. It's the fact that people that have insurance, their insurance rates are going to go up. The leader of the Democrats in the Senate, the number 2 guy, said that just the other day on the Senate floor. There are a lot of different reasons that people are opposed to this, and that's why Nancy Pelosi is trying to pull this trick where she's trying to say it passes without having people to vote for it. Because you know what? They don't want to vote for it because they know it's not good for the country.
I do have one last question because I just thought of it. Especially when you look at history, the only time that all three houses have been covered by one party, just like it has been, usually it averages out 2 to 4 years, and then people always throw the Senate or the House to the other party. Saying that either the House or the Senate goes Republican, are you guys going to put something forward with your own bill for health care in the near future, or is it just going to be dead like it was in the mid-90s?
I'd like to go for a bipartisan solutions that people know will work, because what we have now isn't this. This is a one-party effort, like you just said. You have the same party in charge of the House, the Senate, and the White House. But, you know, I've been medical director of the Wyoming Health Fairs for over 20 years, been trying to provide people of Wyoming with affordable, high-quality, accessible health care, and I'm going to continue to do that. I did that before Obama was elected president, and I'm going to keep doing it no matter who's president.
What do you think about Obama as a person?
Well, I enjoy his company. I like everybody as a person. I just don't agree with his policies.
Okay. Well, I thank you, Mr. Barrasso. Don't talk to NC about my questions, because I'm going to try to get an interview with him, and I'm going to throw him the same questions I asked you. I do appreciate your time, and thank you for answering my questions, because obviously this is a very heated subject, and like I said with myself, I've been on the line with it. There's things that I agree with the Republicans. There's things I agree with the Democrats. I just want something to get done. So can you do me a favor and just get something done?
I'd love to get something done with both parties working together on the things we agree on.
All right. I appreciate it, Mr. Barrasso. You have a great day.
Hey, thanks, Ryan.
Not a problem.